Thank you, Mr. Chairman. This is, I think I'm on now. Thank you all. Senators Murray and Senator Alexander, this would not have happened without y'all. We thank you, as you've done in this committee. You've brought differences, those with differences you've brought together and have come up with a bipartisan product. I also want to thank Chris Murphy, who has been so good to work on all the time as we both kind of tried to navigate to avoid the shoals of partisanship, to find that sweet spot of something that could pass, not perfect from his perspective or perfect from mine, but perfect in the sense that it could pass and bring improvement to our current system. I also want to thank Brenda Destro, who, my staffer, worked on this, had to take an involuntary leave. She'll be back, but she's watching on C-SPAN. She is remembered. And lastly, Chris mentioned the groups that have supported. I want to thank the patients as well and the families who have taken their time to speak to us. Now, I suspect they have spoken to each of us because Senator Murray referenced someone whom she knows. But really, this bill is for them who have made the effort to convey a very personal part of their life to us. And I think it's a credit to the Senate that we are responding to them. A couple things I will mention in addition before I go to my amendment. The same-day rule, as a physician, it is crazy, excuse the pun, that if you have a family practitioner who sees a psychotic patient, he could, under current Medicaid rules, not refer the patient down the hall to see a psychiatrist. Or if a psychiatrist sees a patient who has diabetes out of control, could not refer the patient down the hall to see the family practitioner. Clearly, people with mental health issues have an incredible amount of physical illness. They die in the mid-60s as opposed to the rest of us dying in the mid-80s, and so I think this begins to address that need. Lastly, HIPAA. Chris mentioned that. I'll just say that HIPAA is a mess. I remember when it comes to the mentally ill, when I remember in Energy and Commerce, we had a panel of experts speaking about HIPAA's application to the mentally ill, and the experts began to disagree among themselves. And I said, if you're an ER physician at 3 in the morning trying to make sense of whether or not you can speak to a patient's family, and the experts don't know the answer, I can tell you that physician at 3 o'clock in the morning, she does not know the answer either. And so I think we've attempted to bring some clarity to that, which is very good. Now, that said, among the things I will highlight in addition, and then go into my amendment, is that in this bill, we have emphasized the need to focus on serious mental illness. As examples, schizophrenia, bipolar disease, et cetera. We have emphasized the need to better coordinate policies and programs across the federal government and to improve leadership at HHS and at SAMHSA. And this bill does that. It does establish a focus on helping those with serious mental illness, or SMI. It does establish an interdepartmental serious mental illness coordinating committee to address the issue of the fragmented approach that we currently have to interagency and interdepartmental coordination, and it addresses the need to strengthen leadership on mental health policies within HHS and at SAMHSA by giving an expanded role to the Assistant Secretary for Planning and Evaluation, and by creating within SAMHSA the position of a Chief Medical Officer, and that person shall be a psychiatrist. Now, frankly, I wish we could do more. I think that whoever heads SAMHSA should be a psychiatrist. My point all along is that we have medical doctors at the head of CDC, we have medical researchers, the head of the NIH, we have MD researchers at the head of the FDA, MDs serving as the Assistant Secretary of Health, and even though it's not required that we have a psychiatrist, that we have a lawyer appointed to the Supreme Court of the United States, in reality, unless you're an attorney, you need not apply. That said, not everybody in the committee agreed with me. We did, however, create a position of a Chief Medical Officer as a senior advisor on mental and substance abuse issues. But to emphasize the point, I think we need more qualified leadership. I want to offer the withdrawn amendment to bring further attention to this issue. Specifically, the issue I will offer would give directive authority to the Chief Medical Officer by making that person the Director of SAMHSA's Office of Policy, Planning, and Innovation, OPPI, as it is known. This is to be the hub of innovation, a mental health policy lab for developing and evaluating evidence-based practices, ensuring they are implemented and expanded through the SAMHSA grant programs. I do feel that given the CMO directive authority over the OPPI raises her or his profile further from someone who is a senior advisor to someone who actually directs resources. This change would serve to further empower the Chief Medical Officer at SAMHSA, strengthening her position, authority, and leadership within the agency, and raising her profile across HHS. I believe it would move the ball farther down the road, down the field. But that said, that's one of the battles in here that we had to compromise on for the greater good, and I withdraw the amendment, but I look forward to working with my colleagues further as we pass out this bill. Again, I thank the chair, the ranking member, and Chris Murphy for his leadership and their leadership on this important issue. Thank you all. I yield back.